Morning, everyone. Dr. Brian Sten here at Wilkins Spinal Care. I'm sure you guys are tired of seeing me because I just did a video not even 24 hours ago. But as promised, I wanted to talk real quick about a treatment plan. Nothing long today. Essentially, just want to talk about a treatment plan, how we formulate it. So with the treatment plan, we formulate that all through the exam we give you, the x-rays, and the scan that we do on your very first visit. So the next day, you come back in for your report of findings, which I'll talk a little bit more about a report of findings next week. We take that time to put everything together into your report of findings, and that will include your treatment plan. Just as we talked about yesterday with the 3 phases of chiropractic care, pain relief, stabilization, and wellness, we put that all together to determine how many visits we think you will need in order to get you all the way up to that wellness care. Now at this office, it's a little bit smaller, so with the decompression we do downstairs, everybody starts to mingle patients. And a lot of patients be like, well, hey, why did they get 10 visits and I got 30? Why? Or vice versa. Some people are like, hey, I want 30 visits, but I only got 10. It just depends on the condition that patient is. Some patients need 10, some need 20, some need 30, some might need more. It just depends on the condition and how bad your pain is. So we put that all together so we ensure the best care possible. Now, a lot of patients will ask, well, what if the treatment plan is at its end and I'm not better, or I'm not where you expected me to be, or not where I want to be? I usually just say to patients that we'll cross that bridge when we get to it. And so far, I've never had that point where someone has ended their treatment plan and I've seen no results at all whatsoever. A lot of patients will just say, let's extend, or a lot of doctors will say, let's extend it a little bit more. Some will, usually most, just cross that bridge when it gets to it, but usually we don't see that. But that's just real quick about a treatment plan, just nice and quick, simple today. Monday, we're going to go into a new topic. It's going to be our last one before we start getting into the cooler stuff with what conditions we treat. We're going to talk a little bit about patient communication, the report of findings. And again, the reason why I want to emphasize that a lot is patients, we want to make sure that doctor and patient communication is at its highest peak, because we want to make sure that we get a good health history so we can ensure that we can treat the condition and get you better at a quick pace. But that's all I have today. Have a great day, everyone, and I will talk to you guys on Monday next week.